So far, there have been nearly 45,000 confirmed cases worldwide. Just a short time ago, the global death toll passed the 1,100 mark. And there are still more than 5,000 people stuck on a pair of cruise ships in Asia because of concern over the outbreak. Here in the United States, the CDC says so far nearly 400 people have been tested or are under investigation. The investigations and observation are taking place in 37 states and territories. And so far, of those 400 people in this country, 308 have tested negative. 6 states, Massachusetts, Illinois, Wisconsin, Arizona, Washington State, and California all have at least one confirmed case, and a total of 13 Americans have tested positive for coronavirus so far. At sea, another nightmare is unfolding as we speak. The MS Westerdam, a Holland America cruise ship owned by Carnival, has more than 2,200 people on board. It departed Hong Kong on February 1st for a 14-day cruise. But due to fears of the coronavirus, no port is allowing this ship to dock. The ship has been denied entry to 5 countries: Japan, Taiwan, Guam, the Philippines, and today, Thailand. Thailand's public health minister issued a statement on Facebook saying, quote, "I have issued orders. Permission to dock refused." Outrage over these quarantines on ships is growing in the global medical community. Here's Meg Tirrell.
Well, thanks, Contessa. Another cruise ship in Yokohama, Japan, is under quarantine until February 19th. Dr. Amish Adalja of Johns Hopkins says he's shocked by what he's seeing.
It's like a disaster zone here.
As fears and case counts rise on the Diamond Princess cruise ship, public health experts say the decision to quarantine the roughly 3,700 people aboard is cruel and scientifically unsound.
This is something that didn't need to be done. It doesn't make sense to quarantine people on that ship and allow them to be picked off one by this virus.
The number of people with the novel coronavirus on this ship nearly doubled this week to 135, the largest concentration of infections outside China.
This is something that could be handled by letting all the passengers disembark, medically screening them, giving them instructions on what to do if they develop symptoms. But keeping them on that ship is cruel and likely unethical. If you're in the virus's perspective, a cruise ship is basically an easy, what I would call a shooting gallery, where they can just find victims very easily to infect.
And we're joined once again tonight by Dr. Scott Gottlieb, the former FDA Commissioner. And Dr. Gottlieb, you heard Dr. Adalja there calling this cruel, unusual, keeping these people on the ship. What do you think about this situation and that approach?
Yeah, well, look, I think it's unfortunate. I think they need to find a way to get those people off the ship and quarantine the people who need to be quarantined, let the people who don't have the disease go home. But, you know, this is going to provide some important insights into the severity of this illness following these individuals now who have been infected. We're going to probably get a pretty good estimate of how many people progress to more significant disease, unfortunately.
And we have seen those numbers rise. We also want to ask you about a trip you're taking tomorrow morning down to Washington, D.C. to testify in front of Congress on the U.S. response, how we can be prepared. What are you going to tell them?
Well, we're taking a little bit of a broader look at that hearing about preparedness generally to these kinds of events. I'm going to be talking about some of the issues around the supply chain, the disruptions in the supply chain. When you look at what's happening in China, what's being shut down in Wuhan, in the Hubei province, are facilities that manufacture starting materials for medical products, particularly for drugs. So not the intermediate products, what we call the active pharmaceutical ingredient, but the actual chemical starting material that goes into the API. And that's going to impact the supply chain, cause disruptions. A lot of the fill finishing is done here in the U.S. for drugs, but a lot of the API, which is made in China, the starting materials done in India, the starting material comes out of China.
All right, we examined that a couple nights ago with Rosemary Gibson, who wrote that book, China RX. And of course, you have experience as the FDA commissioner dealing with this with hurricanes. I want to ask you also about the numbers coming out of China. They changed their methodology into how they confirm a case to only include people who test positive and show symptoms. And we have seen the case counts go down. What do you make of that change and what the case counts can tell us?
Hard to tell. I mean, it's hard to tell whether or not the reason why it's going down is because of the reporting. People aren't now presenting to the doctor because of all the measures that have been implemented, or whether or not the measures that China has taken to quarantine people, keep people at home, is actually having an impact in preventing propagation of the illness. I think the issues around China's reporting, I think we've really eclipsed it, frankly. I think we need to focus more on what's happening in Singapore, Japan, Hong Kong, other nations where you now see introduction of the virus to see if it becomes epidemic in those regions. China is still important because it's going to tell us how severe this illness is, some of the data that's coming out of China. But it's very clear this is epidemic throughout China right now. And I think that the statistics from day to day are a little less important from China in terms of telling us what's going to happen globally.
Senator Tom Cotton was on Squawk Box this morning, and he was pretty adamant that he doesn't trust what's coming out of China. And he says if they were really about getting to the bottom of this epidemic, that they would admit Western scientists into Wuhan and to be working cooperatively toward a vaccine. At this point, if you are no longer concerned about how China is reporting its cases and whether we've peaked in Wuhan or not, then how important is trust in China?
Well, we can't trust China. I mean, China's been obfuscating from the outset. They didn't admit that there was human-to-human transmission until around January 20th. They knew that early January. They didn't admit that they had a cluster of unusual illness associated with the coronavirus until late December, after that physician who now passed away went onto social media and not got picked up. So all along, they've been delaying putting out very important information. The key detail here that they held back was that there was human-to-human transmission. Had we known that earlier, we might have implemented measures sooner.
Dr. Gottlieb, in San Diego, we got news that the CDC had mistakenly released someone who was under quarantine, thought that the test for coronavirus came back negative. It turns out that test was positive, and this patient reportedly was mingling with some other people who were under quarantine. How problematic is that kind of false negative, and then what happens after it?
Look, I think the CDC can do effective tracking of the people who that individual got into contact with. The issue aren't the people that we know about, it's the people we don't know about. For every individual that came in with the virus that we identified, there's probably 4 or 5, maybe more, who came into this country that we didn't identify who may be spreading the virus. And that's what's going to lead to the outbreaks in 2, 3, maybe 4 weeks that we need to identify early and try to contain.